Good day everyone, we are Group L. This video we will talk about one of the foodborne pathogens that is the third leading cause of human death. They are known as Salmonella typhi. This will be the reporters that will be reporting through the whole video for you.
Introduction. Foodborne illness is caused by consuming contaminated foods or beverages. Foodborne illnesses can be caused by a variety of microbes or pathogens that contaminate food. Most foodborne diseases are infections caused by a variety of bacteria, viruses, and parasites such as Salmonella. Salmonella is a bacteria that makes people sick. They were first discovered by an American scientist named Dr. Daniel E. Salmon in 1885, who isolated the first organism, which is Salmonella choleraesus, from the intestine of a pig. Salmonella is the third leading cause of human death among food-transmitted disease. There are many types of Salmonella, and one of them is Salmonella typhi, which will be discussed in this presentation. Salmonella typhi are bacteria that infect the intestinal tract and the blood. The disease is referred to as typhoid fever.
Next, the characteristic of Salmonella typhi can be described with their morphology characteristic and their culture requirement. As for their morphology, Salmonella typhi is a rod-shaped bacteria or bacillus with the size about 1 to 3 microns long by 0.5 to 0.6 microns wide. They are arranged singly or in pairs with no spores and capsule. Since Salmonella typhi has flagella, they are able to have a movement. Salmonella typhi belongs to the Enterobacteriaceae family, and they are gram-negative bacterium, which signifies high amount of peptidoglycan, a mesh-like substance that provides structure and also strength. Next, for their culture requirement, and ordinary media like nutrient agar medium and McConkey agar medium are commonly used for the cultivation of Salmonella typhi in laboratory. On McConkey agar, Salmonella colonies will appear colorless and transparent. Other alternative medium that can be used is blood agar medium, where the colonies will appear grayish-white and grows well. The optimum temperature for their cultivation is 37 degrees Celsius, and they can survive at 4.1 to 9 pH. But the maximum growth observed is around 6.5 to 7.5, which slightly acidic to slightly alkaline pH. Also, the pH requirements are varied as per the strain of Salmonella typhi. For their oxygen requirement, Salmonella typhi is an aerobic bacterium that grows best in the presence of oxygen. But some are facultative anaerobe bacteria which can survive with or without oxygen. Now let's move on to the sources where Salmonella typhi can be found in contaminated food and water or contact with stools of infected people. They are prevalent in foods such as dairy products, meat products, shellfish, vegetables, and salad.
Next is the transmission of Salmonella typhi. So how is the Salmonella typhi spread? Salmonella typhi transmission is spread by the fecal-oral route. The Salmonella typhi transmitted by using several modes or patterns of transmission. Now, what is the fecal-oral route? Fecal-oral transmission means from feces to mouth. The route can be various of modes or patterns, and it can be indirect transmission or indirect transmission. This figure shows the different ways that the fecal-oral route can occur. As you can see, the fecal-oral transmission is occur via the 6 F's, which they are food, fingers, flies, fluids, feces, and vomits. Now, we will go to the modes or patterns used by Salmonella typhi to transmit. Salmonella typhi is transmitted by using two types of modes or patterns, which they are person-to-person transmission and vehicle transmission. Person-to-person transmission happens when people that currently ill or recovered, but still passing the bacteria in their poop or stools. This also can happen when you touch or even eat food or drink a beverage that has been touched by infected person. And as for vehicle transmission, it refers the transmission of pathogens through vehicle, in this case, water and food. Water and food usually serve as passive vehicle for Salmonella typhi.
Symptoms. Typhoid fever is caused by Salmonella typhi bacteria. Possible signs and symptoms include high fever as high as 39 until 40 degrees Celsius, weakness, stomach pain, headache, diarrhea or constipation, cough, loss of appetite, and rash. These symptoms usually appear 1 until 2 weeks after infection with Salmonella typhi. With treatment, it quickly recovers in 3 until 5 days. And without treatment, recovery can take weeks or months, and symptoms may reappear.
Treatment and prevention of Salmonella typhi. Infections caused by Salmonella typhi may involve serious complications and require treatment. The only effective treatment for typhoid is antibiotic. The most commonly used are ciprofloxacin for non-pregnant adults and ceftriaxone to prevent death. Other than antibiotic, it is important to rehydrate by drinking adequate water. In most severe cases, where the bowel has become perforated, surgery may be required. Prevention from Salmonella typhi. First, wash your hands. Frequent hand washing with hot soapy water is the best way to control infection. Wash before eating or preparing food, after contact with animals, and after using the toilet. Use an alcohol-based hand sanitizer for times when water isn't available. Second, avoid raw fruits and vegetables. It is because raw produce may have been washed in contaminated water. Avoid fruits and vegetables that you can't peel, especially lettuce. Third, avoid drinking untreated water. Contaminated drinking water is a particular problem in areas where typhoid fever is endemic. For that reason, drink only bottled water or canned or bottled carbonated beverages. Next, cook and store food at the appropriate temperature. Do not eat raw or uncooked meat, poultry, and eggs. Avoid food that is stored or served at room temperature, and it's best to avoid food from street vendor where it's more likely to be infected. Food should be stored in a refrigerator with temperature between 4 degrees Celsius or cooler, or freezer with temperature negative 18 degrees Celsius or cooler. Lastly, before traveling to a high-risk area, getting vaccinated against typhoid fever is recommended. This can be achieved by oral medication or a one-off injection. For oral medication, it is used a live attenuated vaccine. It consists of 4 tablets, one to be taken every second day, and the last tablet is taken 1 week before travel. For shot, it uses an inactivated vaccine. A single shot is given administered 2 weeks before travel. Vaccines are not 100% effective, and caution should still be exercised when eating and drinking.
Now, we already know what is Salmonella typhi and how dangerous it is to human health. So, can we answer this question together? If yes, please leave your comment in the comment section. Thank you for watching our video. Bye!